Hello everyone, this is Dan Paulus, Senior Customer Marketing Manager at HealthStream, and I'm here in the HealthStream headquarters. I recently had an opportunity to talk with Bridget Lai from Hawai'i Pacific Health. She's one of our best customers of a number of products, but we were able to talk about one in particular, HealthStream Video Plus. Is it Aloha or Mahalo, should I say?
We'll start with Aloha.
Okay, very good, very good. So you're here in Nashville visiting with us, and we're grateful for that. We'll accept an invitation to Hawaii anytime you want to extend it.
You're welcome anytime.
All right, good.
Anytime.
We got that out of the way. I've been told you're a fantastic customer for a number of reasons. You've been a great partner in using HealthStream products. You've gotten great feedback. You've been very helpful to other health systems and other hospitals on the islands. Today, we're going to talk about this story of how one of the products actually helped save some lives during the pandemic, right? But before we get to that, let's talk about Hawai'i Pacific a little bit. Tell us about, the mission and kind of your role in the local community.
So Hawai'i Pacific Health is a 4-hospital system. We've got over 70 access points for care on the islands throughout the state. Our mission is to create a healthier Hawaii. It's very, very simple. It's also very broad and expansive. So that means providing quality, high care for every patient every time when they're within our 4 walls, but it also means taking care of our community. So we focus on things like literacy and food security, which we know impact healthcare outcomes.
That's wonderful. So tell us where you're at on the islands, which island and kind of how you're situated.
So our 3 Oahu facilities are Palimomi Medical Center, Straub Medical Center, and Kapiolani Medical Center. And then we have Wilcox Medical Center on the island of Kauai. And then we've got clinics on 5 islands.
Okay. And you've been with Hawai'i Pacific for a while now, right?
I have. I've been with HPH for 19 years.
Okay, that's wonderful. In an education role all that time, or?
No, just for the last 14.
Oh, that's still a pretty good run. Tell us a little bit about being a HealthStream customer.
So we've been on the platform since 2007. I've been a HealthStream administrator since 2008. So I've done a lot of playing in the system, for sure. We are on the learning platform. We have the checklist platform as well as competency. And most recently, the video platform as well as nurse residency.
Okay, so video, which we're going to talk about today, is new, and that's kind of exciting. Why did you need a new solution? What kind of brought up the idea to try this one out?
So in this particular case, we have seen certainly an uptick in the use of videos, the need to provide video training for staff. We know that that's a really good way to reach people. It's a really good way to get a lot of information out to people at a time of their choosing when they can't necessarily attend an in-service or that sort of thing.
It's so important, yeah.
But we were utilizing our own intranet to deliver videos. So we would host just the video files on random intranet pages, and people would have to kind of navigate to maybe 7 different pages to find the video that they needed. It wasn't searchable, and certainly completions weren't trackable on our video.
Oh, that's very important, right? How were you producing the videos? Was there kind of an in-house team that was doing that for you, or what tools were you using to actually create what you needed?
I'm the in-house team.
You are? Well, welcome. Great.
Me and a handy cam when we first started.
So you're very comfortable with where we're at today.
Absolutely.
That's great. Okay, good. How long did it take to create and launch the ECMO course is the question I had.
So our ECMO program took about 3 weeks for us to kind of hotwire it and get it up and running.
That's all? That sounds like a short amount of time.
Well, we were under a lot of pressure to get this program out for sure.
Should we set some context here? This was during COVID, basically?
This was during the height of the pandemic, and our state was on lockdown for much of the first year
Intense
of the pandemic.
Lockdown, I heard.
Intense lockdown.
Right, like I was talking to a colleague who I think you shared, you couldn't go out with someone you didn't know.
You couldn't go out with someone who didn't live in your house.
Right, and people were being pulled over by the police.
You could be ticketed for
that.
Yeah,
that is. I had no idea it was that intense in paradise, so to speak. So
yes.
Okay.
So under those circumstances, we certainly were not able to bring people in for groups of training. Mm-hmm. We saw the kind of shift in healthcare and the need for potential additional adult ECMO providership. Okay. We've had a long-standing neonatal and pediatric ECMO program at Kapiolani Medical Center, but wanted to start up adult ECMO at Straub. It seemed nearly impossible, given the fact that we couldn't bring in people to train them for long periods of time in large groups. Decided to look at leveraging the video platform to take the lecture content, didactic content, to deliver that via video. People could learn on their own time. We kind of chunked out the content to meet adult principles of learning needs for our learners. They were able to complete the content in 4 separate kind of segments or chapters. Once they completed the end of one segment, there was a 1-hour online Q&A. So we utilize web-based classroom scheduling.
Oh, like a live Q&A
And so
that you're
people
following?
zoomed in
Okay, great.
to attend the Q&A via the HLC platform. And then at the culmination of it, we did bring people in for one just abbreviated simulation session, so direct application of everything that they had learned.
Okay, so you were moving from having courses offered in person and training with however large those groups were to totally online with this getting people trained and certified, having the Q&A that they could actually make sure that they were, and then kind of a final certification at the end of this?
Yes.
Okay.
Yep.
Super smart. How much time did that save you, do you think, in the process of doing it that way?
For the first cohort, I would say we didn't save much time because of the front end of kind of getting everything set up for sure.
Yeah.
And actually, once the first cohort was completed, we were able to bring people back for training.
Okay.
But we didn't. We decided to stay on the platform.
Okay.
So since that time, we've been able to save not only the classroom space and conference room space, which on an island, space is precious.
Indeed.
So it's oftentimes hard to get rooms. It's hard to book providers and have them rearrange their schedules for instruction. So we've saved a lot of time there. And then certainly saving the staff's time with blocking. They used to have to come in for like 2 8-hour shifts. And now they're able to, again, view the video content at a time of their choosing. And then we only need them to block an hour for the Q&A. And then at the end of week 4, they come in for that dedicated simulation time.
Okay, so we want to get to the great part of the story is how did this end up saving 13 lives basically during the pandemic?
So before we outlined this program and rolled it out on the video platform, we didn't have an adult ECMO program. It didn't exist.
Didn't exist at all? Okay.
No, we had delivered ECMO a few times at Straub, but we didn't have a standing program and we didn't have a team of individuals who were dedicated to this. Following this, we were able to deliver care to those 13 individuals who otherwise would have not potentially had access to ECMO. And would not have been able to receive that life-saving treatment.
So you attribute there's a direct relation to being able to offer this new training via the video platform that helps save these lives.
Absolutely.
That couldn't make us happier. That's exactly what we're here for. Just a little bit of time left. Yeah. Any additional outcomes that you kind of saw come out of this as part of the training? And have we helped you reach some of your organizational goals as a partner?
I think so. We are always in healthcare being asked to do more faster.
With less, too.
Yes. So we need to train staff quickly, swiftly. We also want to meet the staff's training needs. Our staff in healthcare are tired. They have a lot of change and information coming at them over the last several years. And so we want to be able to deliver content to them in a way that's meaningful, where we can validate their learning, but at the same time, not require them to come and sit in a classroom space if that's not necessary or needed. So we are happy to be able to free up the clinicians' time for the faculty, as well as the clinicians who are learning, where they can, again, learn at their own pace, at their own time. They can rewind the video. If there was a part about oxygenation that they didn't particularly understand, they can rewatch that part. In a live classroom setting, you don't have that benefit. It kind of goes by and you can't get them to repeat what they said because they're going to move on. Right. So that's been really, really beneficial. We've kind of shifted and adjusted that to multiple types of equipment as well as other training materials that we need to deliver, where we're able to either provide a similar model where people can learn at their own pace, or more importantly, even that just-in-time training where you can access that video when you're working on the unit and quickly get back to the content.
We're really getting behind just-in-time. It's clearly the future. So, Bridget, I want to thank you for joining me today to have this conversation and share this great story. Again, we always love to hear this. And thanks for being a great HealthStream partner.
Mahalo.
Thank you, mahalo.